So the EVO ICL is actually placed in a surgery center. So usually patients come in and their pupils are dilated and they will receive IV sedation in order to relax them and make them feel more comfortable. We will then numb the eye with eye drops, and we're also going to clean the eye also, and then place an eyelid separator. And then through a small incision, which is usually about 3 millimeters, the EVO ICL is inserted inside the eye, and then it is placed behind the iris, behind the pupil and the iris, and it is actually invisible to the naked eye. It can only be seen by an ophthalmologist or optometrist during an eye examination, but no one else would be able to see it. After the EVO ICL is placed in one eye, we usually do the same procedure for the second eye. I would say it takes about probably 15 minutes per eye, so within a half an hour the procedure is done, and then the patient is taken to the recovery room, and then usually they would stay there for about 10-15 minutes and then be sent home. After the ICL procedure, we usually see the patient within 1 to 6 hours later. We see them in the clinic, and that is because we want to check the intraocular pressure. So in about maybe 20% of the time, sometimes the intraocular pressure can increase a little bit. That is not unusual, and so we do want to be checking for that. The nice thing is when we see patients after their procedure, within an hour or so, their visual acuity is really amazing. Some patients are seeing 20/20 right off the bat, and that usually continues to be the same, by the next day also. So the recovery after the EVO is extremely fast.